Contraception crops up a lot in the exam. Candidates are often tested. So we thought it might be useful to give you a few key points about contraception, and we've selected in particular contraception after childbirth. Now, this guidance has come from the FSRH guidance from January 2017, and I'd strongly recommend that you take a look at these. Now, the first point to make is that contraception isn't really required before 21 days after childbirth, but you can initiate contraception immediately. And with the exception of the combined hormonal contraception, most contraceptive methods can be started right away. If you start off with an intrauterine contraceptive or a progestogen-only implant, then if you do this immediately, there are high continuation rates and a lower risk of unintended pregnancy. If you're counselling your patients about when to conceive, then you ought to tell them that with an interpregnancy interval of less than 12 months, there's an increased incidence of preterm deliveries, of low birth weight babies, and small for gestational age babies. When do you start contraception after childbirth? Well, most methods, apart from the combined hormonal contraceptive, can be started immediately, but remember that contraception isn't really required before 21 days. If we look at the different types of contraception, if we start with an intrauterine contraceptive, this can be fitted immediately after delivery, or at least within 10 minutes of delivery of the placenta. Following caesarean section or a vaginal birth, then the intrauterine contraceptive should be fitted within 48 hours. If it's delayed more than 48 hours, then you should wait 28 days before fitting. Progestogen-containing contraceptives, whether implants, tablets, injectables, can be started at any time. The combined hormonal contraceptive can be started at 21 days, unless the patient is breastfeeding, in which case it can be started at 6 weeks. Now note that this is a change in the guidance from earlier versions, and you may be tested with that. With barrier contraception, if you're fitting a diaphragm, this should be delayed 6 weeks after delivery. When you're revising for the AKT examination, it's worth revising emergency contraception after childbirth as well. Remember that emergency contraception isn't required within 21 days. Levonorgestrel and ulipristal acetate are safe to use from 21 days onwards. Copper-containing IUDs are safe to use from 28 days. You need to consider whether the mother is breastfeeding. If she's breastfeeding, then you can use levonorgestrel. With ulipristal acetate, breastfeeding mothers should express the breast milk, not give it to the baby, and continue to do that for a week after it's been given. The combined hormonal contraceptive can be started at 6 weeks in breastfeeding women. If they're not breastfeeding, they can start the combined oral contraceptive at 21 days. For breastfeeding mothers, all of the progestogen-containing forms of contraception are safe to give with no adverse effects. These include progestogen-containing implants, injectables, and tablets.